The Future of Health Security in America, HIPPO, Health Insurance Prospective Payment Option. Stop rectifying Obamacare insurance policy and work on HIPPO healthcare for the less insured. Sinking costs and drugs, the argument from morality. We needn't compensate Mother Nature for human medicine. God bless the United States of America. Introducing HIPPO. Under the healthcare system of the present-day United States, there's a ton of people with no access to quality coverage, and a lot of their states are less than adequately insured or not insured at all. Everyone else is paying through the roof to keep up with insurance coverage month to month. For all those who want to change now, there's good news. HIPPO and the similarly named plan GHOST, which stands for Government Healthcare Options, Services, and Therapy, alleviates the burden of unaffordable healthcare in the United States. HIPPO and GHOST excessively compensates healthcare professionals directly for all their clinicals, including nurses, doctors, assistants, and paramedics. How does this work? Well, it works first by bypassing the insurance and then initializing healthcare reimbursement on a regular basis to every healthcare professional you have at your last hospitalization. For example, it works like this. Sarah Livingston's caregiver is Dr. Ian Smith. Sarah pays about $400 a month for quality coverage to avoid paying insane doctor's fees, out-of-pocket costs, and various expenses. Dr. Smith, on the other hand, makes a little more than $70,000 a year annually. The U.S. federal budget on health and well-being is in excess of $4 trillion annually. And with 1 million workers in the healthcare industry, this does not make sense or add up. Ideally, then, every healthcare worker ought to be making at least $200,000 a year annually. But this is far from what's going on, with incorrect cost allocation policies and norms in place. This system can be changed effectively if outsourced to a separate and independent government agency, such as HIPPO or GHOST. The magic is as follows. Sarah Livingston will have to pay now, instead of $400 a month, just $50, and Dr. Ian Smith will be making close to $120,000 a year in annual income by government-sponsored and approved HIPPO GHOST premiums. Healthcare in the United States is effectively saved. Not to mention that the internal government organization can facilitate prescription costs and dental, too. With trillions in annual savings, research grants to big pharma companies can increase, and those employed by them and CVS alike will benefit in turn by superior high wages and possible added benefits. Sarah is the only one among those who already have their own private health insurance, but now her costs have come down by a lot. She can do away with private health insurance. Thanks be to HIPPO and GHOST. For now, healthcare and expenditure expenses in the United States have come down to just $2 trillion instead of being $4.1 trillion that they are now. The essential health benefits include emergency services, lab runs, hospitalization, childbirth and maternity, substance abuse and mental illness, outpatient, pediatric care, prescription drugs, preventative care, rehab, vision, and dental. Insurance policies like GHOST and HIPPO have no set limit on lifetime spending on healthcare services. We pay for all of your medical costs. No need to go through your employer or your insurance broker. Individual health plan plus group health/family plus Medicare and Medicaid, all under one roof. Sinking costs. Presently, we are going to charge a lot for patients for their hospitalizations. Is it possible to charge a lot less? Sure it is. It's only the energy costs that come up with hospitalizations, and there are the nurses' fees as well. All of these fees can be done away with. All the doctors and nurses want is a decent income.